Well, we are getting an update now on the Ebola crisis and the ban that's been instituted on those coming in from certain areas on the continent which are placed at high risk. And to give us more perspective from a health department here in South Africa, I'm joined by Popo Maja. He's the Chief Director of Communications at the Department of Health here in South Africa. Popo, good to have you with us here. This new ban that's been put in place, does this mean that the Department of Health will up its screening processes taking place at the airport?
Yes, indeed. In fact, it was not the decision of the Department of Health per se. It was a decision of Cabinet that said yesterday that considered all the risk factors for South Africa and concluded that to protect our citizens, we need to take precautionary measures and thus totally ban the visitors coming from or travelers coming from those particular countries.
Maybe if you walk us through the kind of processes that will be put in place here, Popo. Are you going to monitor everyone who comes from a flight from the high-risk areas in West Africa?
Yes, indeed. They will have to go through an elaborate medical questionnaire, and also they will be subjected to a rigorous medical examination. If they're coming from that area, and if they have some symptoms of or some signs of illness, they will then be quarantined and be subject to a more comprehensive medical test or examination.
Mr. Popo, this is Mr. Naja. This is Wale from Lagos. I want to get a clarity on whether or not Nigeria is one of the countries. We know Nigeria's case is really isolated to Lagos and only a few cases, and it does seem like the issue has been contained to a large extent. So is Nigeria part of the list of countries where non-South Africans are banned from traveling into South Africa?
Well, we would not get visitors from South Africa directly from West countries in the West Africa. They via Kenya or Ethiopia. Yes, indeed. We will ban those people coming from those regions. And unless there's an absolute and compelling reason why they are traveling to South Africa, then an exception can be made.
What does this mean for the workers and employees at South Africa's and Africa's busiest airports? Are you also putting contingency plans in place to protect the employees?
There's really no need to protect anybody. There's no reason
Popo, you can carry on with your response if you're with us on the line. Okay, well, it does seem that unfortunately we've lost Popo there. He is Popo Maja, the Chief Director of Communications at the Department of Health. They're updating us on the South African Department of Health's increased measures to monitor everybody who comes in from one of those high-risk regions in West Africa and ensuring that the spread of Ebola does not further penetrate onto the rest of the continent.